My body, my choice. My body, my choice. My body, my choice.
Good morning, I'm Francesca from the Havering Daily. We are outside of Queen's Hospital this morning for the pro-choice protest. It's a peaceful protest, as you can see going on behind me. There's many members of staff here. They've come out to complain about the government mandatory vaccine programme. They're saying as from the 4th of February, many of them are going to lose their jobs, and it's estimated that up to 1,300 members of staff from the building behind us are going to lose their job. Now, it's not just even a case of redundancy, they're just going to be sacked. Simple as that. You have the vaccine or you are out. I'm joined by Colette here today, who's a physiotherapist. Colette, as from the 4th of February, staff here are sacked.
Yeah, pretty much. So if we haven't had our first jab by the 3rd, we'll be getting our letters of termination the next day. And then our last day of work will be the 31st of March.
Okay, and we've been saying that 1,300 members of staff right across this hospital are going to be sacked.
Yeah, so that's roughly the number of staff who haven't yet had it. So that's going to have a massive impact on patient care across the local community. So it will mean over 10% of the staff of the hospital will lose their jobs.
This hospital is already short-staffed. We know NHS hospitals right across the country have got an issue with staff shortage. This is a huge blow to people in the community, or people in the communities right across the country.
That's right. So we already have, as you mentioned, staff shortages. So this is going to mean it's going to mean longer waiting lists, cut services, and the real worry is particularly with maternity. There's quite a large percentage of the staff in maternity who may lose their jobs. So that could potentially mean, for example, that the birthing centre has to shut down. So that's going to have a massive impact on the community.
It's important just to let people know that this is not an anti-vax protest. None of you here are anti-vaxxers. You all work in the health industry. You're not against vaccinations. Some of you have even had vaccinations. The key point here is that it's a mandatory vaccine. You're being forced into something without, your choice.
That's right. So most of us here today have had all our previous vaccinations. So yeah, we're not anti-vaxxers. We've done our own risk-benefit analysis on ourselves, and we've decided that this isn't the right choice for us. And as healthcare professionals, we think that informed consent, bodily autonomy is absolutely crucial. That's what underpins the whole of medical ethics, and it's what we practice with our patients every day. So we really believe in fighting for this. We think this needs to be stopped now.
Right, I'm joined by Chinwe, who's a nurse who's just finished her night shift actually, and has come here today. Obviously, Chinwe, you must be really angry with what's going on.
I think angry is an understatement. I'm furious because my liberty to make a choice about what goes into my body has been taken away from me. This is the same thing that I fight for all the patients that come through the door. In the past 16 years I've been working for the NHS. I was trained and told to uphold patient choices. If they're coming through the door and they don't want the treatment I've offered to them, I first of all have to do a mental capacity check to make sure that they have the understanding of the benefit and disbenefit of whatever choices I'm offering to them, and then make a choice based on that. Whatever choice they make, I have to respect it. But today, I'm told that I as a person don't have that right to make the same choice. And everything else I've done within the NHS, especially in the past 22 months, that I've sacrificed my life, that of my family, not knowing what I'm facing within the unit when this all started, when we had no PPEs. Today I'm told that I'm going to be sacked come April 1 if I don't take the jab, even though the jab is an experimental drug.
I'm joined now by Marius, who's a physiotherapist who was deployed to the intensive care unit during the pandemic. Marius, tell us why you're here protesting today.
Hi, I'm one of the physio. So one of the main reasons why I came here on this early cold morning is to basically support my colleagues, support all my friends who unfortunately they are facing a sack, and it looks like it's going to happen. And I feel really, really sorry about the situation. I think this is a catastrophe, and I'm very, very sad that our servants in the government, created such a thing. And
they've taken the freedom of choice away from people, haven't they?
Oh yeah, totally, totally. And this protest is all about that. Just to say that we don't agree with this, and it shouldn't be like this, and we should have freedom to make a choice. Always.
Always. Brilliant. Thank you, Marius. That's the key message here. It's the freedom to have the choice.